thank you for joining. I really appreciate you. I appreciate both of you for accepting my invitation to join this conversation because I feel it's very important. So before we proceed, I will first introduce myself and then we can all introduce ourselves. Is that good?
Good.
Okay, super. So my name is Oyinda. My full name is Oyinda Mola Alabi, but I'm fondly called Oyinda for short. And I am originally from Nigeria, and I've been living in the Netherlands for the past 8 years. So I currently work as a pedagogic professional. However, I'm also a sensory practitioner, a certified developmental baby massage teacher, um, a tummy time practitioner, and I'm currently in training to become an advanced developmental play practitioner. So, yeah, that's basically what I do. And in all that I do, my goal is, especially what I do with Little Steps and Snuggles, the goal is to be able to support parents as much as possible, share tips and tricks on how to support babies and toddlers in reaching their milestones without pressure. What is important is, love, bonding, and connection. That is what I really preach, because bonding, love, and connection is what is what that is truly is that's what truly matters at the end of the day, because that's the memories the child is going to carry on, forever. So that's basically about me. Who wants to go first?
I can go. So I am Julia Vilota. I'm from Brazil. I live here in the Netherlands for 3.5 years. I am a teacher, a childhood teacher, and also a mom, my biggest and mainly role now. And I have a 15 months old boy. And yeah, I'm super happy to be here today to talk about this important conversation, right? It's really important. And yeah, that's most about me. I'm also at the moment staying at home with my son and also studying about the neuroscience of childhood sleep.
Oh, wow.
So
Wow. That's amazing.
that's
That's
me.
amazing. Thank you very much. We are so happy to have you. I am so happy to have you on here. And yes, I actually forgot to say that I'm also a mom. I'm a mom to two boys. My first one is 5 years old, and my second one is 13 months old. Okay, so I'll let my other colleague to also introduce herself.
Oh, I'm sorry. Just a moment. I forgot to say that we met each other at work,
Yeah.
and Oinda was one of the first teachers of my son. So that's really special.
Thank you so much.
Yes, go ahead.
Okay, now my turn. Hello, I'm Frida. I'm from Indonesia. And then I'm already 8 years, I think, in here in Netherlands. And then, uh, now I'm working as a householder. So I'm working from my house. And then I'm so happy to, and I also a mom from my son. He is 4.5 years now. And I'm so happy to talking with you again, my ex-colleague.
Yes. Thank you
Yeah.
so much, Frida. It's so nice to have you on here. And yes, a little backstory about Frida and I. So Frida and I, we've worked together for how many years? So we first worked together for a couple of months, and then we were apart, and again we came across each other again, and then we worked for like the next 2 years. So Frida has always been chasing me. I don't know. So I'm just so happy to have both of you on here. I'm really excited, and I'm very grateful for you guys for accepting my invitation, because this topic is very, very important. And to be honest, I have not seen yet about, people talking a lot about this topic, because what you just hear is, oh yeah, it's time to go back to work. Let me take my child to daycare or take my child to the Gausada. But nobody talk about how do you, prepare yourself and your child for the change, because it's a big change, and it's not just your child that is going to go through that transition. You as a parent, especially a mom, you're also going through a big transition, like you're going back to work after going back to work from maternity leave, and then you also want to, move away, so to speak, from your baby or your child. So it's a difficult situation, and I feel it's good for us to, talk about it on how can we, encourage the parents to prepare themselves, prepare their babies or their children, to adapt to daycare. So our topic today, we'll be discussing about adapting to daycare. So my first question is, how do parents prepare themselves for daycare? Because we often forget about the parents. We just feel, oh yeah, the child needs to go to daycare. We just get a daycare and then put the child there. But we don't remember to talk about the fact that it's not only the child that will experience the change, the parents also will also experience, the change, will experience the transition. So what, as parents, as early years practitioner, as a childminder, Frida, what are the tips, based off of your own experience? What can we advise, or how can we encourage the parents to prepare themselves for this, this big phase, this transition? I would like Frida to go first.
Yeah, for me, the first thing is the parents must be sure about where they will put the kids later after maternity leave. Like, is it to the daycare or the house other? And then they must feel confident with that place, that they will put the kids to that organization or with the house other. Yeah, because if the parents feel not confident, so the parents are, oh, okay, I must start working again, and then I must put my baby to daycare, and then they just find the available daycare, and then after the day they will bring the kids to daycare, and then the parents feel not secure, anxiety with the location, with the teachers who will take their kids to the kids. So for me, the first thing is the parents must be sure. So make your time to find the right place that you confidence, that you sure, where you trust, where you will put your kids to that location or to that person. That is very important, because if the parents feel not secure, if the parents also feel doubting, but the person or the organization, the kids also will feel the same. But if the parents already feel secure, okay, I'm sure with this place, I'm sure with this person as my co-workers to take care of my kids during I'm go to work. I think if the parents feel like that, the kids also will feel, maybe in the first time the kids will be feel, but I think if the parents feel secure, the parents feel confident, I think the kids also will feel the same. That will make us as a caregiver or as a teachers also make it easier for me. That is the first thing, is the important, like that.
Super, that's amazing. Yes, I absolutely agree with you. First, the parents need to, look for the daycare or the childminder where they're going to put their children or their babies, to, and then they need to be confident in the place that they're putting their children, because when they're secured, when they feel confident, then it's easier, to transition their babies or their children to the daycare or to the child minder. So yeah, that's absolutely amazing. I absolutely agree with you. And Julia, in your own situation, what do you think? What can you share?
Starting a daycare, I think, is harder emotionally for the parents than for the children. I had experienced that. I think it's most the preparation is most about trust, about expectations, and also managing our emotional.
Mm,
Because it's a mix. It's like a roller coaster of emotion. You feel excited, but you also feel guilty. I think guilty is the word that I
mm,
felt the most.
mm, mm,
But you need to understand why are you putting your child in the daycare. Understand your situation. So that I had to look at myself and look what is happening in my life, because my wish was to be at home with my baby, right?
mm,
But I had to stop and think, no, Julia, you need to work, right? You need to go back to work. That's your reality now. So that's important. So you need to see your situation and understand uh, that's that's what I can do now. That's my best. Yeah. So many parents feel like they are leaving their baby, but it's not that. Actually, the daycare is a place that your child is expecting, uh, expanding uh, the world, right? They are going to develop there. They are going to have socialization. So that's really important. What Frida said about trusting the organization, the caregivers. So visiting before is really important. And here in the Netherlands, it's common. You go when the baby is still in the belly, right? You visit the daycare and the baby is still in the belly. That was funny for me, thinking about the Brazil, about the experience I have in Brazil. And that's really nice because you can go with calm. You can go in different times. For example, you can try to visit during the morning one day, and then next month you can try to go to visit during the afternoon to see the dynamics of the school, of the daycare. And yes, you have to feel trust about your choice. Uh, what else? Prepare about the adaptation is also know that takes time. So sometimes can go in a week, sometimes can go 2 weeks, 3 weeks, 1 month, or maybe 2 months. We never know because each child is unique, right? So yeah, I would say that for the moment.
Super, that's amazing, really. And one thing you mentioned that I really, really, really resonate with and I really appreciate is that our how we view things. So when we, because like you said, I also felt the same thing. I had my baby last year February, and I had to go back to work, and I'm like, oh my baby, am I going to leave you? I mean, I work with children. I've been working with children for over 10 years, and I still felt the same.
Mhm.
And I still felt the same guilt that I'm going to leave my baby. But then I like what you said when you said that when you think about the fact that the daycare is not that you're going to abandon your child, but you are putting your child in a place where your child is going to experience the world, where your child is going to, grow, be stimulated to reach their milestones, to learn social skills and so many other skills that is going to help them to grow. So when you begin to think in the positive, to think that way, I think it's going to really help us to, regulate our nervous system, really. To help us to feel calm. And, putting that thought in our mind also help us to, it kind of supports our decision in choosing, the right daycare, or the daycare we feel most comfortable with for our babies or our children. So I think that's a very good way to look at it. Don't look at it as if you're abandoning your child, but look at it as, oh, I'm taking my child to the place where my child is going to experience the world. And it will help to calm our anxiety, and calm our nervous system. So because if we don't feel calm, like what Frida said, if you're too anxious, it's going to transfer to your child. And you cannot regulate your child if you yourself are not regulated. So that's a very good one. I really like that point. So thank you, Frida and Julia, for your tips. So then we'll move to the next question. It's kind of the same as the first question, but this time we'll be discussing from the perspective of the child. So how do we prepare the child or our children, or how can we encourage parents to prepare their children? What I mean is, it could be baby, it could be toddler, because it's going to be different for a baby and different with a toddler. So how do we prepare a baby and a toddler for this transition? How do we prepare them? Okay. Maybe I go with Julia first. What do you think?
Yes, I can talk. I don't know if I can divide like baby and toddlers.
Yes, you can.
I can. Yeah, but I think it's most the same, I would say. Well, in my experience working as a teacher, I used to work more with bigger ages, like 2.5 to 4 years old. But now I had the experience as a parent with my baby. But I would say that the important points are routine. So you need to have.
No, I can hear you, Julia.
Hear you, yes.
Okay, yes, now I hear you. Can you hear me? Super.
Was my connection?
Yes. It just went off.
Okay, I hope everything's okay.
Yeah, it's fine.
But let me know if I freeze. Well, let me give some steps back. Okay, so I would say it's quite the same for both. Talk about the daycare, even if it's a baby. It's nice then to hear what's gonna happen. So I try to always have the same phrase. For example, my son Thales, you are going to the daycare today. You play, you eat, and mommy will come back. So explain. Even if you think, but he's a baby, he's not going to understand. No, he is understand. He is listening to you. So this is important. I think practicing about separation is also very important. Imagine that a baby or a toddler that is going to the daycare for the first time, and he is not used, he or she is not used to be away from the mom or from the daddy. I think it's nice to practice this separation gradually. For example, when you go to the grandma house, for example, and you say, "Oh, I'm going to make some coffee, stay here with grandma playing." Then you go away. So this is nice because the baby and the toddler can practice how is it, how is the feeling to be away from you. And also it's nice when the baby or the child knows different people. If you stay with your baby only inside home, only with the same faces every day, all the time, when suddenly goes to the daycare and see so new faces, I think it's scary, right? So I think this is very important to have this socialization before the daycare, so the baby can see different faces, because it's gonna be scary for him. Imagine being in a new place and so many new faces. The routine, I said. So wake up, breakfast, for example, breastfeeding, getting dressed, and daycare. Always the same routine, because babies and yeah, children in general, they they learn best and they feel more secure with predictable things. So he knows what's going to happen. With the bigger ones, we can try to use some visuals, cards, like showing a routine. So here are you were in your bed. It's time to get up. Now you're gonna eat your breakfast with pictures. It can helps as well. And then the daycare. Maybe you can take a picture of the daycare, take a picture of the teachers, and say, "Oh, look! Today you're going to see Miss Oinda. Today you're going to see Miss Frida." So I think this help as well, mainly with the biggest ones. Um, yeah, I have some more addings, but we can chat now.
Super. That's yeah, that is really, really on point. What you've all the things you've mentioned, routine, um, supporting if it is a toddler, supporting them with visual prompts. Also, the babies, talking to them is also a way of preparing them, because, of course, we might think that they are babies. They don't understand what we are saying, but they do understand, because they feel, they feel our emotions, and everything. They can feel it, because if you're like talking to your baby, you already feel calm, you feel relaxed, and with that relaxed state, you are using that state to express what is to happen with your to your baby. Then they feel it, and they feel okay. Yeah, I think I should, or I put it also makes them calm, and then the transition won't be so big or overwhelming for them, and also for you as a parent. So yes, I think you've made a very solid point. Before I move to Frida, I just wanted to add to how we can also prepare the babies and the toddlers for daycare. Is for the babies, especially with the moms, if you're breastfeeding, I feel it's very important that you introduce bottle early enough
You
to
gave
your
me
baby.
this tip.
Yeah, to your baby, because sometimes also, because it depends on the distance between your work and the daycare. For some people, if they work close to the daycare and it's very convenient for them with their employer, they can go to the daycare to breastfeed their babies, or it's allowed. But if the daycare your baby is going to they're going to put your baby is far from your workplace, it's very important that you introduce bottle to your baby early enough. I mean, even if it's one per feed, like even if it's one time, like for example, in the afternoon, you've already pumped, and then you put the milk in the bottle. You can even ask a family member, or your husband or your partner to feed your baby. So it trains the baby to be able to understand how to use the bottle. Because if you don't introduce the bottle early on, and you feel okay, when it's time, I don't have to give him bottle. When it's time for my baby to start the daycare, I'll just tell them to give him bottle. It should be fine. She should be fine. No.
It'll be
It
harder.
doesn't work like that. It's going to be very hard, and you don't want it to be very hard. The transition phase, you don't want it to be very hard for your child. You want to ensure that your child have smooth transition as much as possible. So I would advise that, please, early on, introduce the bottle. Is very important. Try to look for the bottle that is suitable for your baby. because parents can make research on the best bottle that they can use for their baby, and then especially for breastfeeding moms. So because some parents, the reason why some parents do not want to introduce the bottle early on is because from experience of what I've heard or what have been mentioned to me is that they are afraid that the child will forget how to feed directly from the
From
breast.
the
No, it
breast,
doesn't.
yeah.
No, but I think it's a myth.
Confusion about the
Yeah, like, or
teaching.
the child will be confused that, oh, is this
Mhm.
the breast? Is it? No, I feel it's a myth. Just once you practice,
There are so
practice.
many different bottles as well, right?
Exactly. There are so many different bottles out there. There are some very good bottles that the nipple, the teeth, it's just like it mimics like the real breast. So just make your research on the best bottle out there and introduce bottle to your baby early on to to support the baby in having smooth transition with feeding.
Mm.
Then I think having said that, I'll move on to Frida to share with us what you think about us parents preparing babies and toddlers for daycare.
Yeah, I'm agree with both of you. Yes, how we prepare the kids go to the daycare. The same like Julia, the important thing is we must talk to our kids. What's gonna be happen? Like we make like a picture. Okay, tomorrow we're gonna go to the daycare. What you will meet your teachers. You will meet your friends in there. You will be playing with your friends. You make a picture to the kids so they the kids will be have an idea what will be happen later when mama not there. You know. And also the same like a baby, very important. The baby, the two things is important for the baby is the drink or eat, and also sleep.
Mm,
Mm.
For
mm,
things for the baby in that age, yeah, uh, 0 until 1 years. Because in the sleeping times, not only sleeping, because when they are sleeping, the brain is start to be growing. So that's very important. So if you want to bring your kids to the daycare, please try have your baby not always sleeping in your arms because that's not ideal if you want to bring your baby to the daycare for sure because we not only have one baby, we have so many baby and also with the other kids. So try to bring your baby sleep on the crib, Maybe in the beginning it's difficult, but if you have plan to do that, you cannot carry your baby anymore to fall asleep.
mm.
So if that happens, it will be very difficult. Your baby will sleeping on the daycare, and then the sleeping time is very important for your baby. So that's also most important for your baby to try have step by step your baby sleeping by independence by themselves. That is that's what I think. Yeah.
Thank you very much, Frida, those points. Really, the sleeping, that's like another story on its own.
Oh
That
no, yeah.
sleeping is very important, especially for babies, because yes, like Frida mentioned, drinking, feeding, and sleep is like the most important. And that sleeping, once you know that your child is going to go to daycare, as much as you can, try to see how best you can support your child with sleeping. So also the sleeping is it can be tricky. It can be tricky. But I feel maybe we can just like generally just talk a little bit on okay, what can we do? We can't really like give a direct answer because the situation is different. Babies also are unique, but just generally speaking on okay, what can we just do just to ensure that this child is able to sleep at the daycare or with the Gaussauder? So what I'll just say briefly before I pass it on to you, Julia and Frida, about the sleeping is that the parent need to look for like a reading or routine or rituals as some people call it, how to, you know, to ease to how do I put it down? to support the child with reading, routine, and rituals in order to sleep independently. It could be just carrying your child first or rocking your child a little bit, and once your child falls asleep, then you put your child in bed. But if your child is just sleeping, for long hours on you, of course, it's very important for your child to, for this contact
Okay.
at that early age is absolutely important. Like, is they need it. You need that connection, you need that bond with your baby. But also encouraging independent or somewhat independent sleep with your baby is important for the baby to have smooth sleep transition in the daycare. So, like kind of like for me, what I did is to introduce the pacifier. In the beginning, he didn't want the pacifier, but I'll just try, and then I ensure that the place is quiet, rock him a little bit, and once he falls asleep, then I put him in bed. Or sometimes in the beginning, in the first 3 months, I'll put him in bed with I'll put one of my clothes very close to him, so he can still smell, like he's still smelling me. And then you can also help him to sleep well, that, oh yes, you're safe, we're around, I'm not leaving you, you can sleep. So just kind of looking for that reading on, observe your child, try different things, and then once you see the one that is working for you, make it up as a routine or a reading or a ritual to support your child in sleeping. And then when your child wants to start daycare, or if the child is going to go to the Gaussauder, you can explain to the Gaussauder, okay, this is the thing we do at home. If you can continue also with my baby, so my baby can fall asleep here. Because if you just put your child, a lot on just physical contact on your body to sleep for the hours in which they sleep, yeah, it might be a bit difficult for the child to sleep in bed or sleep independently at the daycare or at the Gaussauder. Yeah, Frida, what do you think about this?
Yeah, yeah, and I also maybe in the first week when you bring your kids to daycare, I also suggest don't. Well, if the kid is okay, if the kid is fast to adaptation with the daycare, but if the kids have a difficult time to adaptation, I suggest the parents not the long times, to bring your kids to the daycare. Give it times, maybe a half day first. So the rest of the day they can still take a rest at home, And also for the kids, it's very difficult time for them because for to fall asleep, because that's the moment from their conscious to unconscious. That's for baby is very not secure, If I fall asleep, is it mommy is still there or not? Something like that. That's why yeah, you need to make sure our baby feels safe. That's why first time, like I told you, that you must feel secure, you must feel confidence with the person that you will give your baby, because if you feel safe, and then the baby also feel the same, so the baby also will feel easier to fall asleep. I also have experience with my kids in here, because these parents from Asia and I also from Asia. That's our typical from us as a mom. We like to carry our baby
Yeah.
every time we carry baby. For us, that is the love language, but actually also not good. After I'm working in daycare, I'm learning, and then I also have experience with my son. Actually, skin to skin is important, but not only when the sleeping times, You can do it during play times. You can skin to skin. You can play with baby, but in the sleeping time, you must if the baby feels safe, that's easy for the baby to fall asleep
Hmm.
because
Mhm.
I'm safe. I'm okay. There's someone with me, and then that person also feel there's for me. That's what I feel. The same like my experience. So the mommy always carry this baby, and then she also, oh yeah, I'm sorry, I don't because this is the first kid also for her. I always carry my baby to fall asleep. I say okay. Luckily, I only not so many kids like in the daycare. So in the beginning, I will try, but please, can you do also do the same at home?
Hmm.
uh, Carry the baby to fall asleep, but you can be there when the baby will fall asleep. So in the beginning, I try to help her, the baby carry my arm, but the for the second nap, I put the baby on the back and on the crib, and then I try to pat the baby just a little bit, and then slowly but slowly, the next day only 3 days, and then the baby can sleep by himself because the parents also do it the same at home. That is the that's what I learned. That's the baby feels safe with the uh
Environment with also with the care, with the teacher or the caregiver, and then they
and
can sleep.
it's more easy for the baby to fall asleep by
Super. That's
And
amazing. That's amazing. Before I
let
pass it
me
on
ask,
to you,
I will
Julia.
try to.
Yes, please,
No,
Julia.
no, you can say sorry.
Okay, super.
I cut
Thank you.
you.
Yeah, I wanted to mention that I really appreciate what Frida mentioned because we so that some people will not feel that, oh, can't we have contact with our children? No, this what we are saying exactly. What we are saying is that you can have contact with with your baby because that's like the most important thing. However, like Frida mentioned, is not we don't only have skin to skin contact when the child is sleeping. We can have the contact when during playtime, when the child is awake. But because your baby, in this case, a baby, is going to the daycare, and you want to support your child in having smooth transition at the daycare, especially with as regards sleeping, it is important that you see what works best with you. Come up with a routine, a reading, or a ritual that can support your child to be able to sleep, independent, quote unquote, independently, or just sleep in bed, you know
Mhm.
because it's important. That aspect is very important when you want to put your child in daycare or with the gas holder, because in the daycare, the reality is that they have other children that also need the attention of the caregiver or the educators.
Linda, your voice you cannot hear. I cannot hear your voice.
Yeah, I stop it for a moment.
No, not yet.
Can you hear me now?
Yes.
Super. I think my mic went off. So, yeah, as I was saying, like it's very, yeah, important that the parents look for this rhythm or routine that can support their babies, in the aspect of sleeping, because at the daycare, the reality is that they have other children that needs the teacher's attention, so they can't be 1 hour, 2 hours, 3 hours alone with your baby. So it's to support your child is very good that you have some sort of ritual or routine that can really help your child. And then lastly, what I want to say about this is also to highlight what the other thing Frida's mentioned, that when she started looking for a routine, or how to support the child with sleeping, the mom also was practicing the same reading. So what she was doing with the child, the mom was also doing the same thing. So it talks about collaboration. So parents and the educators, the gas holder, they need to collaborate together to see what is practical, what what is practical for both of them, what they can both practice in order to support that baby to have smooth transition. So that's a very good one. So Julia, please go for it.
Yes, I was about to say this point as well, because as a teacher, we would love to be with your child hugging and rocking and wait until he falls asleep, but it's not possible as we have a lot of children. And as a parent, we need to understand that. It's difficult, but we need to. So that's why you help with the adaptation before going to the daycare, presenting your child different ways to sleep. Okay, contact naps, perfect. But what else? Maybe stroller, okay, and how to go to the crib, how to try to shoot him in the crib already, maybe with gentle taps in the bump, or try to create a phrase, and then you can say to the teacher, for example, before putting him in bed, I say it's time to sleep. Later we will play again. So maybe the teacher can say that it's time to sleep. So the brain of the baby, the child can already understand that, oh, it's time to sleep. Something very nice that it helped Thales as well, my son, is comfort eatings. In psychology, we call it transitional objects. It can be a cuddle toy, a soft toy. It can be the favorite toy of for the bigger ones. Can be a picture. So it's like the baby is gonna transfer their emotionally secure for this object. For Thales was a soft toy. So before he goes to bed, he had his soft toy, the same as he's had at home. So it helps as well. Something else I would like to add is about the calm and short goodbyes. Because when we dropped the kid, sometimes you want to hug, you want to cry together, you want to be attached all the time, but then you have to say short goodbye. So it's time, mommy is going to work, I will come back. Kiss, bye. And it's funny because as a teacher, I used to judge some parents. I have to say that. But now, as a parent, I can understand them. I have a situation where some parents stayed for, I think, 1 month working in the daycare, like in the cafeteria area, because they were all the time so worried, and they were showing up like spying between the door. And as a teacher, I was judging a lot internally, like you need to say quick, short goodbyes, you need to go. But as a parent now, I can understand their emotionally what was going on inside them, right? But that's important. We need to feel confident and calm and say short goodbyes. It helps, at least what I have seen during my experience as a teacher. Yeah.
Super, thank you so much. Yeah, that's amazing. Those points are very solid. That we need to, give like the calm, short goodbye that, oh yeah, I'm going to come back to meet you. You're going to have lots of fun with your teachers and your friends today. I'm going to see you later. Yes, because it's also a form of reassurance. You're reassuring your child that you're safe. I'm not abandoning you. I'll come back to get you. So that's really a good one for tips. A good one as a tip for parents. So I'll go with where we've arrived at the last question. So the last one is just basically us just talking about the expectation. So we should do it both ways. So parent expectations and the childcare or childminder's expectation. So what do we as a parent, what do you expect from the daycare or the childminder where you drop your child to or child at? And as a teacher working in daycare or as a childminder, what are your expectations from the parents? Because I mean, both spoken and unspoken expectations. Because if the expectations are not clear, sometimes they can be, dispute. You can have like, a little bit of clash with the parents. But once the parents are able to understand, you know, and also it should be sincere expectations. Do you understand what I mean? It should be what you can provide, not don't exaggerate, or you don't overpromise, because at the end of the day, if you overpromise and you can't live or walk up to or act in accordance to your promise, then there's going to be a problem with you and the parent, or with the organization and the parent. So I feel it's best that both parties, I mean the parents and then the educators or the childminder, understand their expectations. So I will go first just to further throw more light on what I on the question is during. I've had the opportunity to have different intakes, and I always ask these questions from the parents, like, what are your expectations? Just so for me to understand what they're expecting from us, and if we can provide, or if we can live up to those expectations. So then I tell them, okay, this is what we can do, this is what is practical for us, and this is what is not. So they know from day one. So like, for example, from my experience, I'm like, okay, what do you expect from us? They're like, okay, I expect that, you do activity with my child. You're able to track the progress of the growth of my child. And those things, that is what we do. So they are all doable, and I'm like, oh yeah, we can do that. But so a parent have once asked that, oh, one of my expectations is that if you can put my baby, what they call that, oh yeah, in the baby carrier, so that my baby can sleep well. And I'm like, okay, I don't think we can do that. Because if your baby is just with me all through the day, we have other babies, other children that need our attention. So it's a bit tricky for us. And and immediately I was able to explain, because some parents genuinely don't understand. They don't know. So it's better for us to explain to them so they understand. And once we all understand each other, it's very easy to work together.
Yes.
So because you'll be able to understand, the parents' expectations, and they can understand your expectation or what you can do. So I think I'm going to go with Frida first this time again. Like, as a girl Sauda, what in your own experience, what as the parents maybe asks of you as regards the expectations, and what have you mentioned to them, like this is what I can deliver, and this is what I might not be able to deliver because it's not practical for me. I'd like you to cite some examples if you have.
Maybe for me in the household, it's not so much difficult like in the daycare. Because in here, like normally what the parent expectation in for me is like, they like it kids more often go outside than inside the room, the class. And then I think it's more easier because not so many kids, so I have time to communication with the parents, and the parents also directly can see and what's the expectation for me, because they can directly see what who am I, and then what they can get in my area.
Yeah.
Because in daycare normally the parents only come one times to daycare to see the classroom and then to meet so many teachers, so they also don't know which because every day also the teacher is different, right? So they they cannot see for sure with which teachers that they can talk the
Talk
activity.
to, yeah.
But for me, as other, what I expectation to parent is trust me as your co
Mm.
parent, your kids.
Mm.
Let's make communication something like that. It's more easier that I will tell the situation of your kids during they are in here, and then let's you also tell me what happened at home so I can understand. Sometimes like if the kids not sleep well at home and then they come with a cranky like it's totally different like usual, and then I will ask okay, what happened with the kids, how was the sleep, and then yeah, the kid is wake up early and then in the night also not sleep well, so that's why, so I can understand what happened with the kids, so I also can understand during the day what will be happen.
Mm.
Like help the kids. That's very important for me as a
Girl Sauda.
parent.
Super. That's good. Like, yeah, the parents communicating with you about, updating you about, what had happened the previous day or the previous night, and also the parents trusting you, because like that's like the most important. Okay, so I'm going to pass it on now to Julia. Oh yeah, what are your expectations?
Yes, so as a parent, I
Mm.
want to see my baby being seen and loved, not
Mm.
just supervised. That's what I,
Mm.
because uh, it's really difficult as a parent. I would like to be with him, but I need to give it to the teacher, right? So I would like her to see him, to be not his mom, of course, but to enjoy his presence there. And the communication is really really important, as you said. We need to understand how is the dynamic of the classroom. I'm trying to I'm trying to think as no teacher now. Because as you said, maybe a parent don't know.
Yeah.
They don't, maybe they don't know how is it. And that's very important to be honest. So you don't say like I would like, for example, I say to you, I would like to rock him uh, uh,
Sleeping.
before sleeping, until he sleeps, and you say, oh yes, we can do it, but maybe you have um, on Tuesday, for example. Monday you could do that, but Tuesday you had 12 babies, 12 children. Then it's not possible. So you have to say to the parents, be honest, so transparent. That's important. And also parents like to see the development of the child. So I love to see all the activities Thales was doing, uh, things that I cannot do at home, for example, because at home you have a different routine, right? Trying to think as no teacher, just as a parent. And so I love to see about how was his day, if he's sleeping, if he's eating, is drinking, and also to know he cried today. I think that's important for us to know as well. Not hide. For example, oh, he was good all day. No, oh, he had few times of crying. He cried a little bit before sleeping, but then he was fine. And also to know the knowledge of the teacher helping his development. For example, I have a good situation. Thales, it's like a hungry baby, and he likes to eat everything he sees in his front, and he wants to put everything in his mouth. So Oinda, as his teacher, gave me a very nice tip about pacing his feeding, and also showing the plate. That when he was really little, nowadays is okay. Like showing all the plate in front of him was making him maybe anxious and wants to
Also
put
hate.
everything. Yes, so pacing his feet was a very nice tip, and I used that. So it's nice as a parent to see that the teacher is seeing my baby, is looking at him and trying to help me as well as a parent, so we can work together. It's the partnership between the teacher and the parent, so that's really important. And it's nice because the parents are experts in their child. So I am expert in Thales, and you as a teacher is expert in the development, in a child development, because you studied for this. So when both are together and both are working together, it can help a lot. Not only the adaptation that they care, but all the development until he goes to the school, for example.
True,
Yeah.
true, true. Yes, absolutely. You're very right. It's, they say it takes a village to raise a child. So in this question, if I'm putting my child in a daycare, I'm trusting you that you are capable of taking care of my child, and checking my child, paying attention to my child, and also the rest of the children in the classroom, because I am one person in the village. The girl Sauda is another person in the village, or the educators, the teachers, they're also people that makes up the village to support the child, because in the child's world, the child is like, okay, I have my mommy, I have my teachers,
Mhm.
I have my gal Salda too. I have grandma. They don't know the difference between maybe their teacher and then them. They just feel everybody are all family. That's how a child will look at it. That all of us, all of these people, all are my, caregiver, and they're my family. They're the one raising me to develop and grow well.
Mhm.
So yeah, that's amazing, amazing. All your tips are really solid, and I feel that all the things we've said will be able to support parents as much as possible to be able to prepare themselves first and then prepare their children for daycare, or yeah, for daycare, whether a big daycare or the girls older. So this is a bonus question. Is I saw on a video on TikTok, a childminder. I think it's the mom and then a daughter. So they are into child minding business, and their own policy is that they won't accept or collect from the parents a child that is sleeping. That the child needs to be awake and alert before they can collect the child from you. So if you arrive with your child sleeping, they won't collect the child. You have to, like, experience to wake your child up and ensure that your child is alert before they can collect the child from you, because they feel that, your child that is sleeping, maybe, some of my parents be like, oh, my child had a bad night as we're walking or driving. He slept off, and they'll bring the baby in a car seat. And, so they say they will not collect the child from the parents because they are unsure of what had happened. Even if you mentioned that, oh, the child was tired, but they were not there. So they are unsure of what had happened before the child fell asleep. So it's better the child is alert. They can see that the child is really fine before they collect the child from the parents. And I know that different people feel different ways, different things, I mean, or feel differently about what they said. So, I mean, I would like us to maybe just, to share what we think about it. We all can think differently. Our opinions can be different because we are humans, which is okay. So this is not like telling the parents what is right or what is wrong. You discern yourself on what you feel is okay and what is not. But we are just, sharing what we think um, about the child minders policy. So, Julia, okay, what do you think?
Oh, that's really
As a
tricky
parent, if you,
situation.
as a parent now, as a
And
parent, your child. So let's think about this scenario. Let me make up a scenario. So Your baby Thalys had a very bad night. Let's assume Thalys is not like, let's assume it's a baby like maybe 10 months old, for example, had a very bad night, and then you were driving to the daycare to drop Thalys off, and he fell asleep in the car, and then you like, oh, good morning, teacher, and then, oh, Thalys had a bad night, he's sleeping, here he goes. And I was like, oh, I'm so sorry, but I cannot collect Thalys from you. He needs to be awake and alert before I can collect Thalys from you. What do you feel about it?
No.
How would you feel if a teacher tell you
I just, I'm trying to hide my teacher face side. I'd feel like, come on, I had a very bad night.
Exactly,
I've been awake all night. Thalys didn't sleep. I have to work now, and you don't want to accept my baby. He's sleeping. Let him sleep. I think I would feel like that.
I like that. I like that because that's like honest. I mean, as a parent, I will also say the same thing.
Yeah, like, come on, he's sleeping. He's fine. Just let him. It's okay. So when he's awake, he's gonna play. He's gonna eat. Yeah, but let him sleep, please. I would say like that.
Okay, thank you. I'll come back to you. So
Okay.
now let me move on to Frida. Now you're going to talk as a girl founder. Like, what do you think about the policy of those childminder? Do you think let me just ask you, what do you think? Yeah.
I think I will be agree with that rules that we as a teachers that's I will take responsibility about your child. So when the transition that time, I want to make sure that your kid, your baby, is fine, is awake, is alive. So for me, I will be agree with that rules to make sure that when you give the transition time that you give your kids to me, and then after that moment, that's what will be my responsibility for sure. The baby is awake, and I will, because we never know what happened during the sleeping time, because so many things can be happen. Maybe look like sleeping, but after 2 3 times the baby not awake. That will be my responsibility. So for me, I will agree with that rules.
Okay, now I'll go back to Julia. So, if it's a policy, do you think like you be like, okay, I know it's difficult, but okay, I have to. Would you like eventually agree, or you'd be like, oh, I don't like it there. I need to take my child away. What will you do in
I
that?
would see in two perspectives. How is my day?
Mm.
Can I be for I don't know, half an hour here and wait, like in the cafeteria, and then he can sleep a little bit longer, and then I give to the daycare alert, like says the rules. Or I need to go now. I need to go to work. I need to do something else. So I need to give to you. Then I need to accept what the daycare says. And then I can put, can I say the view of a teacher now?
Yes, absolutely. You can now.
As a teacher, I've seen news. I'm not sure. I don't remember now if it was in Europe or in Brazil. I can search later, and then we can put in the description of the video.
Yeah.
But what happened was the baby was sleeping in the car seat during the way to the daycare, and the daycare accept the baby in the seat, the car seat, and let the baby there quiet sleeping. And after few hours, I'm not sure how much, the baby didn't wake up, because we know that is safety. We know that the baby cannot stay longer in the car seat. Even if you go travel, is all important. After 2 hours, give a break, because they cannot stay longer. And sleep is not recommended. And what happened was the baby was sleeping in the car seat. You are not properly, right, laying down. So the car seat, the baby stays like this, and this can block the air through the throat. So, and unfortunately, the baby didn't wake up. So, who is the fault? The parents or the daycare? You know?
Yeah.
So it's a very delicate
Hate
situation.
situation.
Yes. So,
Mm.
so we need to think about it.
Yeah, that's true. It's a very delicate situation because come to think of it, if a child is sleeping and a parent, I haven't worked in a daycare and a parent send a message that, okay, I'm coming to pick up my child in the next 30 minutes, will definitely bring the child awake. I'll give you your child awake and alert. I don't bring the child to you sleeping.
Mhm.
So I understand that, yeah, for safeguarding, for safety, for the organization or the girl father's safety, yeah, I'll agree with that policy that a child, before you transfer your child or give your child to the teacher or the girl sider, your child should be awake and alert, because then it's very clear that your child is fine, rather than when your child is sleeping. It's very difficult to tell if your child is fine or not.
Mhm.
And I will just, in a child care or a childminder that want to do that policy, I will suggest that they need to explain the policy to the parent during the intake, so
Mhm.
that the parent is aware. Because when the parent is not aware, and then I think that's when the whole clash, will happen. But once the parent is aware upfront, or is aware earlier, then it's easy for the parent to understand that, oh, okay,
To agree,
if I
yeah.
have, yeah, to agree that, okay, I have like 30 more minutes to spare. Let me just stay with my child around the corner or the parents' room for my child to sleep more. And oh, I don't have any time to spare. Then you need to wake your child, because at the end of the day, who is going to deal with the crankiness of the child? It's not you. It's going to be the the girls and the other teachers.
Uh-huh.
Of course, you don't want a child to have like stressful morning, but at the end of the day, I feel is really for the safety of the,
Reasons. Yeah.
for the safety of the of the child care and the girls, and even for the child, because then the child is safe and alive. Do you understand what I mean?
Mhm.
So yeah, I feel it's a good policy.
Yeah.
The childminder or the childcare just need to explain to the parents, from the beginning, so then they understand that, okay, this is the policy, this is why we have this policy, so they can follow and then understand the reason why they have the policy. So before we end, do we have anything to add, any comment?
Yeah.
Hmm.
Give a little bit uh, note to the my co-workers as a
Yeah.
teacher, take care, and also to the parents. Separate with the parent is very difficult for the kids. It's a very not easy time for the kids to go to the daycare actually. But yeah, just give it time, give your presence as a teachers for the kids that the parents trust go with you to this kid,
Mm.
to this kid, try to adaptation the situation that new for them until they're ready to enjoy the day in the daycare. And
Mm.
then if you are available, please in the first week, if your kids not easy to adaptation with the daycare, please don't push your kid the long days in the day.
Mm.
If you can step by step, not directly full day in the daycare, but step by step, it's more easy for your kids also, not too many stress for them.
Yeah, absolutely. You start step by step. Take it easy, because so that it's not overwhelming. If you can, it's better to, start the adaptation process early, so then you can just take it easy, step by step, and not just long hours, and don't so it doesn't overwhelm the child.
Yeah,
Absolutely.
that's
Thank you.
that's
Thank you
very
very much.
important. That's
Mm.
very important because if I see in the past, I would do different because I
Mm.
was working. I just had one day off. That was his first day, but the other days was also a little bit overwhelmed. he was crying a lot, no sleeping well. So I think if I got like a week off would be better. I could take him earlier. So if it's possible for your work, would be a really nice tip to take a week off for the adaptation. So it helps a lot. And
Super.
I
Yeah.
and I would like to say that adapting to daycare is a transition for the whole family, right? So, but with trust, with communication, and a lot of patience, this is gonna be a beautiful adaptation, and your baby or child is gaining a new relationships, new experience, and of course, independence and a beautiful development. So it's a process, but it's worth. Yeah, I can say it's worth.
That is amazing. Thank you so much, Julia. Thank you very much, Frida, for your input. Yeah, all your points are solid, and I have a strong feeling that this is going to really help so many parents out there. That yes, putting your child in the daycare or leaving your child with the householder, you're not abandoning your child.
Mhm.
Of course, it's a process, it's a difficult process, but trust the process. Stay calm, regulate your nervous system.
Mhm.
It is really worth the experience. Thank you so much. It was very nice having all of you. And yeah, this is the end of our of our conversation. So thank you, and we'll see you another time for sure.
Thank you.
Thank you.